Good evening, everyone. My name is Kevin Bergerson, and I am the Patient Education Program Senior Coordinator for the Colon Cancer Alliance. And on behalf of the Certified Patient Navigators and the entire patient support team from the Colon Cancer Alliance, I would like to welcome you to tonight's webinar, Understanding Sedation Options for Your Colonoscopy. This is the 13th installment of our Conversations about Colon Cancer webinar series, which we here at the Colon Cancer Alliance have created to provide attendees with the opportunity to link with national experts in the colorectal cancer field together online in an interactive setting. Tonight's webinar was made possible by the generous sponsorship support of Sedasys, a division of Ethicon US, part of the Johnson & Johnson family of companies. The webinar is being recorded and will be available for reviewing on our website in the near future. If you're joining the webinar series for the first time, or if this is your first interaction with the Colon Cancer Alliance, we are the oldest and largest national patient advocacy organization dedicated to increasing colon cancer screening and survivorship. The Colon Cancer Alliance's mission is to knock colon cancer out of the top 3 cancer killers. We are doing this by championing prevention, funding cutting-edge research, and providing the highest quality patient support services. We are passionate about increasing screening rates and survivorship, as well as igniting changes in the way this disease is viewed and discussed. We will work tirelessly to realize our vision of a world without colon cancer. To learn more about us, please visit our newly revamped website at ccalliance.org. Tonight's presentation will provide an overview of some important topics that are key for you to understand and discuss with your gastroenterologist before your procedure, as well as some your insurance company items you may want to discuss, so that you're fully informed on all issues before undergoing anesthesia. Just a quick note here about questions. After our speaker tonight has finished their presentation, we may be able to address a few of the questions as posed by you, the audience, during the webinar. We will accept questions using the webinar control panel. That is the block of controls on the right-hand side of your screens. To submit a question for consideration, click on the small plus sign located next to the word questions on the webinar control panel. Again, that's located on the right side of your screens. Then type in your question and hit enter. As a reminder, our webinar presenters are willing to answer your questions to the best of their ability, but please remember, our presenters are here to inform only, and any specific questions regarding your individualized treatment or individualized billing need to be directed to your clinician team or your billing centers or your insurance companies for clarification. And with that, I'm going to introduce our speaker. Our speaker this evening is Dr. Mark Murphy. Dr. Murphy obtained his anesthesiology and then critical care medicine training at the Massachusetts General Hospital in Boston. His 20-plus years of clinical experience includes faculty positions at Harvard Medical School and the University of Texas Southwestern Medical Center in Dallas, as well as numerous medical leadership positions in both academic and private practice settings. Currently, Dr. Murphy serves as medical director of one of the largest anesthesiology continuing medical education organizations in the United States. His passion for teaching is evident to the thousands of healthcare providers each year who attend his lectures centering on optimizing patient care and safety. Dr. Murphy will discuss the various current sedation options available for colonoscopy procedures, as well as some of the financial considerations you should be aware of, and also questions you should ask your gastroenterologist for your colonoscopy procedure. In addition, we have Marcia McKenna joining us as well. Marcia has been with the Sedasys System project since March of 2003. In a variety of roles, Marcia works with patient advocacy groups and professional societies to help shape public policy and create market access for the Sedasys system. Marcia has a Bachelor of Science degree in nursing from Villanova University and a Master of Business degree in marketing and finance from Boston College. She will be here to assist Dr. Murphy with any questions you may have. And with that, I'm going to turn it now over to you, Dr. Murphy. And with that, take it away, Dr. Murphy.
Hi, good evening, and hello to everyone on this webinar. I am quite thrilled to have been asked to be here with you today and discuss various issues related to sedation for your colonoscopy procedure. Colon cancer screening is a very important component for your long-term health planning. Some patients put off or even completely avoid colonoscopy screening due to anxieties about the procedure or assumptions maybe of the discomfort they might experience. I specifically want to thank the Colon Cancer Alliance for recognizing this important issue and hosting this webinar to hopefully address these assumptions and help make you better informed as you plan for this very necessary procedure. I do want to state that in medicine we have something that is called a disclosure. For a number of years I have served as a medical consultant for educational issues to Sedasys, which is a division of Ethicon US of the Johnson & Johnson family of companies, which is sponsoring this webinar. And again, as Kevin said, the information contained in this seminar is provided for your informational purposes and represents no statements or promise or guarantee by Sedasys concerning the levels of reimbursement or payment or charge that you might receive. While we make an effort to provide information that's current at this time, the information may change and not be as current or comprehensive later on or when you view it. So with that, we move along with the conference. Most patients are not aware of the numerous components that interact to successfully perform a colonoscopy. So this webinar is an overview of some of those topics that are important to discuss with your gastroenterologist during the procedure, as well as your insurance company, so that you can be fully informed of all issues before your procedure. So this evening, we're going to review components of understanding all the various costs of your colonoscopy, the various sedation options that might be available for your colonoscopy. We'll discuss the Sedasys system, a new technique for providing sedation. Then we're going to discuss and consider why does your sedation choice actually matter and why you should specifically address it with your gastroenterologist. And then we'll list some sedation as well as financial questions for you to consider asking both your insurance company and your gastroenterologist well in advance of your planned procedure. There will be Kevin will cover a brief call to action for the Affordable Care Act insurance coverage as it relates to screening colonoscopies. And then at the end of the presentation, as Kevin mentioned, there's additional resources that will be made available to you. So let's take a look at what might be included in your colonoscopy bill. The colonoscopy bill, or actually any medical bill for that matter, can often be confusing or sometimes overwhelming. The bill may vary greatly depending on your insurance, your doctor, the type of procedure you have, the type of facility where you may have your colonoscopy, and even the area of the country where you live. So we're going to look at this from a high level to help you better understand what this all means. There are various costs attached to the various components associated with your colonoscopy. Sometimes these are what is called bundled together. Other times these are charged separately. So you should clearly know which is which ahead of time. There may be charges for your bowel or your colon prep kit that your gastroenterologist will order for you to take prior to your procedure. Then there are different colonoscopy procedures, such as a screening colonoscopy or a therapeutic or a diagnostic colonoscopy. So we're going to briefly go over those in the next slide. Then there are actually different types of sedation used for colonoscopies, and that depends on your gastroenterologist, your health, who administers the sedation, and there may be actually an additional charge for this as well. There may be a pathologist charge. Sometimes a tissue or a lesion is found during a screening colonoscopy that needs to be examined by a pathologist to determine if it's cancer, so there may be a pathology charge for that. And then the facility where you had your procedure can impact your bill as well. Different facilities have different charges for a colonoscopy. These different facilities can be a hospital outpatient department, often abbreviated HOPD, or an ambulatory surgery center, typically known as an ASC, or in the physician's office. And for example, charges for a hospital outpatient department may be more expensive than the same procedure being done at an ASC. As we mentioned, there are different types of colonoscopy procedures, and this is very important for you to understand going in. A screening colonoscopy is an exam of your entire colon to look for signs of colon or rectal cancer. The Affordable Care Act states that insurance companies must cover preventative services, which includes a screening colonoscopy, without any copay or coinsurance. If you're having a screening colonoscopy, verify with your insurance provider and the physician doing your procedure that it's fully covered. A therapeutic colonoscopy is performed when the physician finds and removes a polyp or a lesion. So therefore, your screening colonoscopy could turn into a therapeutic colonoscopy if your physician finds and removes that polyp or lesion. The ACA, the Affordable Care Act, position in this situation is that the colonoscopy still should be fully covered by insurance. But this is a very recent information position, and interpretations can be different. So please discuss this with your insurance provider and your physician in advance so you don't have any surprise charges. And then a diagnostic colonoscopy is performed for a patient who has symptoms such as maybe bleeding or pain, and your gastroenterologist is examining the colon to diagnose why. A diagnostic colonoscopy might be billed differently again. So again, please discuss this with your physician and your insurance provider so you know what the cost to you might be. Okay, in addition to that, your colonoscopy bill may have a technical and professional fees. The technical fee is what the facility, that is the hospital, the ASC, or the physician's office, charges to cover the cost of doing the procedure, such as the room, the equipment, staffing, and supplies needed. The technical fee does not include what is paid to the gastroenterologist. The professional fee, what the physician, in this case your gastroenterologist, charges to do the procedure. If you're having sedation administered by an anesthesia professional, that would be an anesthesiologist or a nurse anesthetist, you may receive a professional charge from them as well that is separate from the gastroenterologist, and we'll discuss this more in detail later on in this webinar. And then the billed charge is the amount that the physician, that is the professional fee, and the facility, that's the technical fee, submits to your insurance company. However, that's not necessarily what they get paid, as many insurance companies pay a percentage of the billed charges. And then the reimbursed or allowed amount is what the insurance provider actually pays to your doctor and the facility. So your particular insurance plan, and they're all different, will determine if and how much of the difference you may be responsible for. When both you and your health insurance company pay part of your medical expense, it's called cost sharing. That's a phrase very frequently used now in medical insurance. There are deductibles, co-insurance, and co-pays are all part of cost sharing. Understanding how they work will help you know when and how much you may have to pay for your care. So in-network means that the physician and the facility have an agreement with your insurance plan to provide those medical services. You should review your health insurance plan and ensure that your physician and the facility is, quote, in network. If your physician or your facility is considered out of network, then the cost to you, the patient, may be significantly higher. Copays, or a copay, is a fixed amount that you pay for your health care services, usually when you receive the service. That amount can vary by the type of service and the type of insurance. For example, if you go to a doctor's office for a visit, you might have a copay of $30, for example. With most plans, you should not be charged a copay or co-insurance for in-network preventative services, which include annual checkups, mammograms, and screening colonoscopies. Please verify that this Affordable Care Act copay statement with your physician and your insurance provider prior to your procedure, though. Okay, a deductible is the amount you pay for healthcare services before your health insurance begins to pay. So let's say your plan's deductible is $1,500 for the year. That means for most of your medical care, you'll pay 100% of your medical and pharmacy bills up until the amount you pay reaches that $1,500, and then after that, you share the cost with your plan by paying that co-insurance we discussed. So expenses related to hospitalizations and surgeries and procedures would typically apply to your deductible. The cost of lab tests, MRIs, CAT scans, physical therapy, medical devices, etc. usually also go towards that deductible as well. Of note, deductibles are lower if you see the in-network versus out-of-network providers. If you choose to see an out-of-network provider, you may have an out-of-network deductible that can be higher and separate from your in-network deductible. So as you can see, there are a lot of variables and moving parts to this. Coinsurance is your share of the costs for your healthcare services, usually figured as a percentage of the amount allowed to be charged. You start paying coinsurance after you've paid up your plan's deductible. So let's say you have a policy with, for example, a 20% co-insurance. That means the insurance company would pay 80% of the covered services after you reach your deductible, and that you would pay the remaining 20%. For example, let's say we'll pick someone named Lisa who has allergies, and so she sees her doctor regularly for that, and she's paid her $1,500 deductible. So from now on, her plan would cover 80% of the costs for her allergy shots, and Lisa would pay the other 20%. That's her co-insurance. So these are some of the phrases that are out there in terms of payment and reimbursement for procedures. And that was a very brief overview of the various components for payment in healthcare. Insurance companies can be very different, though, in how they address charges and payments. So please take care of yourself by being informed of what your specific insurance policy does and does not cover. Let's now discuss the different types of sedation that are used for colonoscopy procedures. In the U.S., a colonoscopy is typically performed using some type of sedation or pain medication to reduce the anxiety and discomfort associated with that procedure. Certain sedation medications are delivered by a nurse, an RN, under the direction of your gastroenterologist, while other medications are delivered by an anesthesia professional, that is, an anesthesiologist or a nurse anesthetist. Most patients don't know that there may be options in the type of sedation that you would receive, and also most patients don't know whether their sedation is included in the insurance coverage for the colonoscopy. More than 20 million outpatient endoscopy procedures are performed in the U.S. each year, and that number is growing, which is great as a screening tool. We're going to walk through the various sedation and anesthesia options for colonoscopy and explain why they're chosen, how they're different, and the various issues attached to them. In the U.S., about 1% of patients undergo a colonoscopy without sedation. You might ask why. Well, those reasons are related to select patient conditions and maybe by patient request. The benefits of this message, as you can imagine, are that you're fully awake, and therefore you will remember everything about your procedure. In addition, you can drive yourself to and from the procedure, whereas if you receive sedation medications, you're not allowed to drive yourself home for obvious reasons. You can return to work or normal activities as soon as you've recovered from your colonoscopy procedure. There's no sedation drug hangover effect, and there's obviously no sedation cost associated with this option. However, the disadvantage, as you can imagine, is if you don't receive any sedation at all, you may experience some pain or discomfort during your colonoscopy, and very few U.S. facilities offer this option. About half the colonoscopies in the United States receive moderate sedation. It's also known as conscious sedation, whereby a combination are given intravenously, that is IV, to block pain and help your patients relax during the procedure. Typically, these sedation medications are administered by a nurse under the direction of the gastroenterologist. An anesthesia professional is usually not needed to administer moderate sedation to healthy patients. Minimal to moderate or conscious sedation is the standard method of sedation for decades. It usually involves giving IV doses of sedatives, which are Valium-like medications, and pain medications, which are morphine-like medications. You'll not be totally unconscious, hence the word conscious sedation. However, you should be comfortable and responsive to voice or to light touch, such as tapping you on the shoulder. The cost of moderate sedation is included in the cost of your colonoscopy if those medications are given by the nurse under direction of your gastroenterologist. Now, the drugs typically given for moderate sedation may cause you to feel groggy for a number of hours after the procedure. Some patients may experience some nausea or vomiting from the pain medicines. And in addition, some of the sedation medications can cause amnesia, so you might not actually remember what your gastroenterologist discussed with you after the procedure. And finally, from a safety standpoint, after you receive sedation medications, you'll need to have someone drive you home, and ideally, you should not be left alone for 24 hours. Frequently, a drug called Propofol, along with a pain medication, is administered to achieve a level of deep sedation or general anesthesia. We'll talk a bit more about Propofol in the next few slides. With deep sedation or general anesthesia, patients should not feel anything or remember anything about the procedure. However, there are added clinical risks of these deeper levels of sedation, such as changes in your breathing or blood pressure, and most healthcare facilities require that the medications used for this type of sedation be administered by an anesthesia professional. Your gastroenterologist will determine whether an anesthesia professional should be involved with your care or not based on your health, and we'll talk about that later. Again, from a safety standpoint, after you receive any sedation medications, you'll need to have someone drive you home, and ideally you should not be left alone for 24 hours. Now, of note, there is usually a separate charge when an anesthesia professional is involved in your care. If the anesthesia professional is requested, those services should be covered under ACA, the Affordable Care Act, for a screening colonoscopy. But again, be sure to confirm this, as insurance company interpretations may differ. So Propofol it's a different type of drug than the Valium type and morphine type drugs we discussed earlier. It's been used by anesthesiologists, nurse anesthetists, and in intensive care units for sedation and anesthetic since 1986. We really prefer that drug for sedation and anesthesia because it's rapid acting, it has less post-procedure nausea and vomiting associated with it, the patients return very quickly to normal activities and productivity, patients experience better comfort and very high levels of satisfaction. Because of these benefits, as you can imagine, an increased number of gastroenterologists have requested Propofol sedation for their endoscopy cases over the last 5 to 10 years. Now, based on state and facility policies that are in place at the time, this has typically required the services of an anesthesiologist or nurse anesthetist, as we discussed. But just like CAT scans and MRIs and robotic surgery, new technological devices continue to be developed to improve medical care and safety of patients. And one example of this technology is that in 2013, the Food and Drug Administration, the FDA, approved a new sedation delivery system for colonoscopies and upper endoscopy procedures. Marcia McKenna-Feldman is here to give you a little bit more information on this, what I think is a very impressive new technology.
Thank you, Dr. Murphy. The Sedasys system is the first computer-assisted personalized sedation system and the only FDA-approved method of administering Propofol without an anesthesia professional at the bedside. Now, there is an alternative to receiving the benefits of Propofol for moderate sedation. Its unique design makes it safe for specially trained gastroenterologists and their nurses to deliver Propofol for minimal to moderate sedation. In fact, the American Society of Anesthesiologists issued a guidance document titled Guidance for Directors of Anesthesia Services for Computer-Assisted Personalized Sedation Devices to address how facilities can incorporate this new technology into practice for procedural sedation. The Sedasys system is indicated for minimal to moderate sedation in healthy patients undergoing colonoscopy and upper endoscopy procedures. The system personalizes the sedation to the individual patient's physiology. Because the Sedasys system targets minimal to moderate sedation, and the trained gastroenterologist and nurse will be at the bedside with you, the FDA determined that you do not need to have an anesthesia professional in the room. However, they will be immediately available for consultation or as needed. In the Sedasys system clinical study, there was very high patient and physician satisfaction with this new drug delivery device. The cost of this method of sedation is included in your colonoscopy, so you do not have to worry about a separate charge for this. While the Sedasys system is relatively new, it is not considered experimental. Over 9,000 patients have been sedated with the Sedasys system. However, the Sedasys system is not yet widely available and has limitations to the patients it can be used on. Again, from a safety standpoint, after you receive sedation with the Sedasys system, you will need to have someone drive you home, and ideally you should not be left alone for 24 hours. The Sedasys system was approved by the FDA in 2013 and is indicated for the administration of Propofol for minimal to moderate sedation in healthy patients undergoing colonoscopy and upper endoscopy procedures. Part of our labeling also lists some of the contraindications with the Sedasys system. They are patients with a known hypersensitivity to Propofol or its components, patients with allergies to eggs, egg products, soybeans or soy products, patients with a known hypersensitivity to fentanyl, pregnant or lactating women, delivery of any drug other than Propofol, and patients with a full stomach. If you would like more information on the Sedasys system, including contraindications, warnings, precautions, adverse events, and additional product information, we encourage you to go to www.sedasys.com to see this full information and to download our essential product information, or you can call 1-800-SEDASYS. Now I'm going to turn it back to Dr. Murphy.
Thanks, Marcia. Okay, now let's look at why your sedation choice matters. Many patients don't know what type of sedation they will receive for their colonoscopy. The type of sedation you'll receive depends actually on a number of factors. It depends on what type of sedation your gastroenterologist offers at his or her facility. It can also depend on the staff they have who administer the sedation, such as a nurse under the direction of the physician or an anesthesia professional. In addition, your gastroenterologist will look at your overall health. If you have significant medical conditions, for example, a heart condition or severe asthma or obesity or sleep apnea, particularly if they're not well controlled, or if you have what we call a potential difficult airway, your gastroenterologist may decide to consult with an anesthesia professional to help with your care. Now, one of the goals of this webinar is to bring to your attention potential financial outcomes that we don't want to have happen to you. This article that you can see on the screen from the New York Times in 2012 appeared and represents what I would call probably a worst case scenario. So I want to briefly go over it. It describes how both the husband and wife in New York City selected their gastroenterologists who participated in their insurance plan, so in network, to perform their colonoscopy for cancer screening. In both cases, the gastroenterologist scheduled the sedation to be administered by an anesthesiologist rather than moderate or conscious sedation that would be administered by the nurse. In both these cases, the anesthesiologists were out of network and the anesthesia fees were not covered by the couple's insurance. The article describes how the anesthesiologist for the husband billed $1,600 for the sedation. The anesthesiologist was reimbursed $588 by the patient's insurance plan, and after failing to collect the remainder from the patient, sent the balance to bill collectors. The wife received a $2,800 charge for her anesthesia service and was told there would also be an additional, quote, facility fee of $1,800 charged by the endoscopy clinic, which was not covered by her insurance as well. Yeah, those are impressive numbers, and these are extreme cases, but I want to bring to your attention, they reflect the wide range of potential charges for anesthesia services and facility fees around the country. Many anesthesia groups, however, and certainly mine, wherever I've worked, coordinate to be in the same insurance networks as the gastroenterologists and surgeons with whom we worked. But this is why you need to be informed and know what questions to ask. Another new area of financial concern for patients, as you well know, is the issue of high deductible plans. That is, more and more patients are finding that in order to reduce your rising monthly insurance premium costs, you're being forced to choose plans with higher deductibles. So again, more out of pocket before your insurance kicks in. With these high deductible plans, you may receive an anesthesia or even a pathology bill, even if your screening colonoscopy should be fully covered under the Affordable Care Act. So as you can see, it's very important to verify with your insurance company before your screening colonoscopy whether these separate professional fees will be covered under the ACA, as they should. So the summary of this section is to keep in mind that you should ensure that your gastroenterologist is in your insurance network. And you should also verify whether any other physicians working with your gastroenterologist, like pathologists or anesthesia professionals, do they also participate in your health insurance plan, and whether those fees for those specialists are covered in full. Make sure you do your fact-finding well in advance of your procedure so that you fully understand how much of the bill you may be responsible for paying based on all the physicians and all the services that you might be involved with your care. So we're now going to go over some specific questions to ask. Now, that being said, healthcare costs and these coverage issues, as you can imagine, are constantly changing on a at least a year basis. And so this next section, sedation and financial questions to consider, is not intended to overload you or scare you, in fact, but simply to provide you with information that you can gather prior to your procedure so there are no financial surprises. Remember, it's ultimately your responsibility to take care of yourself and be well informed. You are taking care of yourself clinically by choosing to undergo a colonoscopy screening for colon cancer, and that's great. But also take care of yourself financially by choosing to ask the financial questions and choose the practitioners who can provide the best clinical service to you at the best price. But most importantly, though, do not allow any potential out-of-pocket expenses to prevent you from getting your colonoscopy, because the costs and the devastating effects of colon cancer are enormous, and it's just not worth the risk of avoiding the procedure. So now we're going to go over some of the questions you should ask when doing your fact-finding prior to your procedure. And remember, you don't have to find a paper and pencil and try and write all this down, because it's all available for you after this presentation. So your insurance company and the gastroenterologist office manager can usually provide this information about what is covered and what is not. So questions you may want to consider asking well in advance of your procedure are, is your gastroenterologist, in network for your health insurance plan? If your gastroenterologist is out of network, remember, you may be responsible for a greater portion of that bill. You can also ask, is your colonoscopy procedure covered under your insurance plan? Screening colonoscopies, as we described, should be covered by insurance due to the Affordable Care Act. But ask if a polyp is found and removed, will that also be fully covered? Are there other components of the procedure covered under your plan? For example, any pre-procedure medications or bowel preps, the facility fee, if there's a pathologist involved, if there's an anesthesia service involved, are those covered in your plan as well? And so finally, what out-of-pocket money will I be responsible for based on the physicians and services that might be involved in my care, is kind of a summary question. Now, because of the Affordable Care Act, your insurance plan should cover the cost of any required consultation prior to your screening procedure if your gastroenterologist determines that that pre-procedure consultation is necessary. That is, for example, if you have some significant healthcare conditions that need to be evaluated. And in addition, very recent Affordable Care Act guidance states that if a polyp is found and removed or biopsy is performed during a screening colonoscopy, then the pathology exam should also be covered without any cost sharing, and Medicare states the pathology exam is critical for achieving that primary purpose of the colonoscopy screening, so it should be fully covered without any copay. But make sure you get this clarified in advance of your particular procedure. Pardon me. Also ask your gastroenterologist or the office manager these questions regarding the type of sedation planned. What type sedation options do you offer at your facility? What type of sedation do you, the gastroenterologist, you're asking this question, do you recommend, and why do you recommend that type? What are the risks, benefits, and alternatives to that sedation recommendation? And is there an additional charge for the sedation? And if so, is that individual administering the sedation in your network? You might ask, what if you want a different sedation option than what is being recommended? And then finally, you might consider asking, can you do my colonoscopy at another facility where you have privileges for less cost? In other words, your gastroenterologist may have privileges, is the word, at a number of those facilities, and the overall cost might be less. And again, remember, if you're a Medicare patient getting a screening colonoscopy, the anesthesia service, as well as the pathology service, should be covered through the Affordable Care Act, but again, ask to make sure. Questions concerning the anesthesia specifically, your insurance provider should be able to give this information to you. If you're scheduled for minimal to moderate or conscious sedation by your gastroenterologist and nurse, verify that that sedation fee is included in the procedure. If you're scheduled for deep sedation or general anesthesia or care by an anesthesia professional, make sure that that professional is in your network plan. And remember, if the anesthesia professional is in network, you may still receive a separate bill from them for a professional fee, but verify that your insurance plan will fully pay for that anesthesia service fee. Because remember, if the anesthesia professional is out of network, typically your insurance provider may only pay a small portion or no portion at all, so make sure of this ahead of time. And again, remember, if you're a Medicare patient getting a screening colonoscopy, the Affordable Care Act says the anesthesia service should be covered. But get this clarified in advance. Please don't wait until the day of your procedure to ask these questions so that you can be fully informed about all the issues related to your health. So we have what we'd like to call some takeaway messages. And the takeaway messages from this are, take care of your clinical health. First, I guess I should say thank you all for attending this Colon Cancer Alliance webinar on sedation issues for your colonoscopy. You made a great decision to take care of your clinical health by discussing with your primary care physician when it's appropriate to have your screening colonoscopy. Make sure to schedule that. Have that discussion. Schedule your colonoscopy as your doctor indicates, and do not put off this life-saving procedure. But also be sure to take care of your financial and emotional health as well, by taking personal responsibility to ask those questions of your gastroenterologist and your insurance company well in advance of your scheduled endoscopy procedure, as we've discussed. So we don't want you to set yourself up for last-minute financial surprises. And finally, and most importantly, I want to give you my personal best wishes to everyone here for a long and healthy life. And with that, I will turn the webinar back over to Kevin.
Thank you, Dr. Murphy. We have a number of questions already. As a reminder, to submit a question for consideration, please click on the small plus sign located next to the word questions on the webinar control panel. And on the right side of your screens, type your question in and then hit enter. And with that, our first question comes to us from Betty. Betty says her uncle, father, sister, and herself all have pseudocholinesterase deficiency. Can you please educate the attendees here regarding the importance of knowing this fact and make sure they know the dangerous outcomes that can occur when given anesthesia broken down by an enzyme?
Sure, I'd be happy to. And Betty, thanks for the question, and kudos to you for knowing your and your family's medical history to that extent. A pseudocolonesterase deficiency is actually a pretty rare condition. It has to do with an enzyme in your body that breaks down certain other substances or components. The medications, specifically talking about sedation, the medications that are typically given for sedation, be that the benzodiazepine, the morphine-like or the Valium-like or even the Propofol medications, are not broken down by that enzyme at all. So there would not be any untoward effect of receiving these particular sedation medications for you or your family's colonoscopy procedure. However, I do want to make it clear that you certainly do and your family do need to discuss that condition with anyone who will be doing any healthcare provider, because there is a situation where if you stop breathing and the people taking care of you have to essentially put a breathing tube in you in an emergency and breathe for you, there is a medication that is most often given in that situation which is significantly affected by that pseudocolonesterase deficiency. So yes, please tell all your providers about that condition. And I should say in advance of that, all the questions that you're asking, I'm happy to answer. They'll all be based on my professional opinion and my clinical experience and knowledge. And so I certainly don't know everything, and that's why I attend these conferences as well as an attendee. And with that, Kevin, if you have another question, I'll try and answer it.
Yes, this is a pretty common question. It comes to us from Walter. Walter would like to know, he had a colonoscopy 5 years ago and everything was okay, and he's a colon cancer survivor as well since 2001. Next year,
Congratulations.
Yeah, that's awesome stuff. Next year, he will be 70, and Walter would like to know, does he need another colonoscopy now that he's turned 70, having had one 5 years ago where everything was okay?
Yeah, Walter, congratulations to you. And my answer is that your particular circumstances are best, that question is best answered by your gastroenterologist who knows you well. Some believe in 5 years, some believe in others. So call your gastroenterologist, ask them. They know your medical history, and they'll be the ones who can give you the best answer of when to have your next screening colonoscopy to make sure that you're still cancer-free.
Very good. Our next question comes to us from Christine. She's got a combination question here, a drug combination question. Her previous combination left her nauseous. The last two times she had a colonoscopy, Versed and fentanyl were used, and for about 20 minutes after she woke up, she would get nausea and vomit. So she's curious what some of her options should be, whether it's getting a different doctor, clinician, team, or is there a suggestion for sedation that she could carry with her to her next appointment. Apparently the last time she was under Versed and fentanyl, it took approximately 4 hours to wake up.
Yeah, hi Christine, great question, and I would say I'm very sorry that was your response. I guess to address you again, if I were your anesthesia provider and you were asking me my opinion, it depends on a lot of variables, of course. One is why you've had colonoscopies and how often and how close they were to each other and what was the reason for those colonoscopies. Excuse me. Yes, Versed and fentanyl are the, as we discussed, the two most common drugs given for sedation. And yes, they do last a bit of longer after the procedure. So that's your how long it took you to wake up. And yes, fentanyl is a narcotic. It is associated with causing nausea and vomiting. But to be fair, depending on depending on why you're getting your colonoscopy, there could be some issues in your intestines that could cause some nausea and vomiting as well as the procedure itself. So no, don't necessarily just change your doctor, but certainly have a conversation with them. Give them that history, and as we said in the question session, ask them, is there the opportunity to receive a different drug Propofol, for example, that causes much less nausea and vomiting after procedures. And it's much shorter acting, so it won't take you the 4 hours to wake up. But again, don't just completely change doctors. Ask that one those questions, and hopefully they'll be able to continue your care with just different medications that won't have that bad outcome.
Very good. I have a question here from Cheryl. And Cheryl would like to know, Dr. Murphy, do you understand the PIR payment for anesthesia when a provider is in a network, but anesthesia is not?
I'm sorry, Kevin. Can you repeat the question?
Yeah. Do you understand the PIR payment for anesthesia when a provider is in a network, but anesthesia is not? This may be a very unique question that's unique to a specific insurance provider, so I'm not sure if you know if you're going to be able to help.
Yeah, well, I'll answer it as best I can if I understand the question. If the provider, I assume that's the gastroenterologist, is in network, but the anesthesiologist is out of network, is I think what the question is. The question is, and it gets us to the that New York example, which we don't want to have happen. So optimally, again, ask your gastroenterologist if an anesthesia professional is to be used, then are they in network? Do the anesthesia professionals with whom they work, are they in the same network as the gastroenterologist and the patients? And PAR is participating, non-PAR would be non-participating in your insurance plan. So again, yes, that would be a specific question to ask the gastroenterologist, their office nurse, and your insurance company.
Okay. And I have a question here from Ryan. Ryan says that he's had Versed and fentanyl with both of his previous colonoscopies. Ryan doesn't feel like the Versed does much of anything for him, and he has been completely awake and alert for both of those colonoscopies. He says that he's had no pain or discomfort with either, which is the whole point of anesthesia. But he'd like to know, is there any reason why he wouldn't want to skip either of those both medications for his next colonoscopy?
So, Ryan, if your question is, would you consider having no sedation for your next colonoscopy, then my answer certainly, I guess, would be you can discuss it with your gastroenterologist. However, I will say that your sensation, you felt as though you were completely awake, but had no pain or discomfort. I would just ask you to consider, do you think that that would still be the case if you received no sedation or pain medicines at all? And it may be that you're a little less sensitive to some of the sedation medications, and so if you would like to be more sedated, less sedated, then that's an easy question to discuss with your gastroenterologist, and I think they would be happy to have that conversation with you and adjust the medications accordingly.
All righty, with Dr. Murphy. I'd like to thank everyone for their questions. We answered everyone that was submitted to us. But we are running a little short of time for this evening, and on behalf of the Colon Cancer Alliance and all of the attendees this evening, I would very much like to thank Sedasys for making this webinar possible. And I would also like to thank you, Dr. Murphy, for your time this evening. Your expertise and time was greatly appreciated. Any parting comments for our webinar, Dr. Murphy?
Well, just my thanks to you, Kevin, and to the Colon Cancer Alliance and to Sedasys for putting this on. It's a awesome topic. It's an important issue, and as referenced by the number of people attending this, have your colonoscopy. Don't give up on that, but ask questions so that financially you know what you're walking into, and yes, there are sedation-related options that you would have. Just please ask.
Very good. Again, thank you, Dr. Murphy. And as a reminder, about this time tomorrow, all of you in attendance will receive a follow-up email with a link to a feedback survey about this webinar. The Colon Cancer Alliance values your opinion, would greatly appreciate hearing your honest feedback and how we can make the delivery of the webinar better. And we would be very interested in hearing any ideas on any future topics you might have. So please look for that email tomorrow, and would appreciate it if you take a survey and let us know your opinions. Thank you in advance for your help. Just a quick note here before I go is I'd like to remind everyone that you can help improve the healthcare process by taking the time to reach out to your congressional delegation and ask them to support the Removing Barriers to Colorectal Cancer Screening Act. That's House Resolution 1220 or the Senate Bill 624. This bill would allow Medicare beneficiaries to undergo colonoscopies without the risk of coinsurance when a screening colonoscopy finds a polyp. Currently, there's that loophole that changes no-cost coverage for a screening to an out-of-pocket diagnostic billing situation should a polyp be discovered and removed. You can locate your congressional representative by visiting contactingthecongress.org and clicking on your state. Finally, for any follow-up questions on this presentation or any other colorectal cancer topics, please feel free to contact the Colon Cancer Alliance's certified patient navigators on our helpline at 877-422-2030. And with that, I would like to thank you for attending. We sincerely hope you enjoyed this webinar. And as a reminder, the webinar is being recorded and will be available for reviewing on our website in the near future. If you would like to share comments regarding the webinar, fill out that survey. And of course, you could always email me at kbergerson@ccalliance.org. On behalf of the Colon Cancer Alliance, Dr. Murphy, and our sponsor, Sedasys, I'd like to thank everyone for attending this webinar. I hope you found it informative and value added. Have a good evening, and take care, everyone.